Thanks for staying with us. It's been 2 years since the first COVID-19 patient was announced in South Africa. In the past 2 years, the country has seen more than 3 million positive cases and almost 100,000 people have died. So what have we learned in the past 2 years and what can we expect going forward? For more on this, we are joined by Dr. Nicholas Crisp from the National Department of Health. Thank you so much for your time, Dr. Crisp. We do appreciate it. 2 years later, it's been a very rough and long road for South Africa. What would you say have been the toughest lessons that the country has had to learn and adapt to as quickly as possible with the COVID-19 pandemic?
Good evening, Heidi, and hello to the viewers. Wow, it's been a roller coaster ride for all of us, not least of all those who work in the health sector. One can almost not even remember what it looked like 2 years ago when everything was shut down and there was these devastating scenes of packing up and people going to hospital, many people dying and so on. It really has been difficult. We've learned a lot, some of it bad and some of it good. One thing is the whole globe was not prepared for what happened, and that's why there's so much talk about pandemic preparedness across the globe now. And that means preparedness not just in the health sector, but preparedness across all the various departments. You know, being ready with supplies, with food, with water, making sure we're able to control the security and so forth, besides what happens in the health sector. We have learned that there's a need to accelerate our technologies, and that fortunately we were successful globally in getting some vaccines in a very short space of time because of the work that had been going on with other viruses and other infections. That was at least encouraging. For us in South Africa, one of the things we have learned very quickly is to work together. I hope we don't forget that as we get into an easier phase of COVID and as we move towards hopefully what will turn out to be a pandemic phase. We really do need all of us, and we need every citizen and person who lives in the country to play their role.
Certainly. Dr. Crisp, let's speak about the vaccine rollout. Many were frustrated with government in the beginning to say we weren't getting vaccines quick enough. Then there were very long queues at vaccination sites with everybody trying to get a vaccine as quickly as possible. There were different phases of the vaccine rollout. But just looking at where we are in our vaccine rollout, yes, we've made significant strides and we have a large number of our population vaccinated, but many would argue this is perhaps not where it should be.
Yeah, absolutely, Heidi. From where I sit, we're extremely disappointed. We have provided the capacity. The entire health sector, public and private, has been ready to accept between 250 and 300,000 people a day for a long time now. We have the vaccines in the country. We've mobilized, thanks to yourselves in the media and others, every media outlet in the country to participate in marketing. There's been a whole lot of social media that we have tried to mobilize. Every scientist that knows anything about viruses has been involved in one way or another in supporting us. So with all this effort that has gone on to reach only 32 million at this stage, I say only 32 million. When I started on the job, I was bet that we wouldn't get to 5 million. So 32 million is substantially more than that, but it's not the huge numbers that we were hoping to get to. We have only 19.1 million people who have received at least one jab and 17.1 million who, according to current definitions, are fully vaccinated. So for us, that's disappointing. We do have the capacity and we would really like to be seeing more people coming for vaccination.
Certainly, I do think that those who aren't vaccinated should really heed the call to get jabbed. I want us to quickly touch on booster shots. You're hearing a lot of people saying, I don't really need a booster jab. Our COVID-19 numbers are down. If there's a new variant, it probably won't be deadly because Omicron wasn't as bad as everyone thought it would be. How important is it for people to actually go and get their booster jab you know, in terms of also protection when it comes to COVID-19?
Yeah, thanks for that question, because it's, you know, for people who seem to think they know what the future holds. 2 weeks ago, nobody thought there'd be a war in Europe. So, you know, you just don't know what's going to happen next. This virus has taught us some very hard lessons about how viruses mutate. And although we think we understand how pandemics roll out, this is the first real massive global pandemic of this, you know, sort of airborne disease and so on that we have experienced since 1919. There have been others, and we've learned from them as well. But at this magnitude, we haven't seen this before. So how we would be confident to say it's all over, I'm very surprised at those people. We are very grateful that it's in a depressed phase at the moment, but anything could happen, and we do expect a fifth wave. And if you are not protected with any form of vaccination and not fully protected, you may well end up in hospital. We still have people of all ages arriving in hospital very sick and some dying. We have only administered 1.38 million booster doses so far. We have plenty vaccine to get to all the 19.1 million people that we've already vaccinated, or the 17.1 who are fully vaccinated can still come for their boosters. So it's not like we are not able to accommodate. It's way too early to start thinking with a vaccination coverage rate of 48% that we can rest on our laurels or let our guard down. Way too early.
I know you're a doctor, Dr. Chris, but many are wondering what's going to happen in the next 6 months, even in the next 2 months with this virus. We are seeing very low infection numbers, and especially if you're vaccinated, it's very mild. But in terms of our understanding of how pandemics work and how a virus like COVID-19 works, is it going to get better? Are we eventually going to be over this? I mean, it's been a very tough 2 years.
Yeah, so time will tell. And of course, we don't know how long the clock needs to tick before we get to a point where we are comfortable. But the nature of what we're dealing with now is also strange. We're still seeing between 6 and 7 per 1,000 tests positive. And a lot of people aren't testing, so we know there's a lot more infection in the community than the 3.5 million or so that are reported. So frankly, we don't know what's going to happen in the next few months. But the patterns and what history has taught us would suggest that sometime in May, we can expect another wave. That wave may be just a slightly different variant of what we've got now in Omicron. And Omicron is already in several subvariants. But it may be a completely new variant. And although historically we would expect that variant to be less virulent and perhaps less transmissive, we don't actually know that. And the virus may transmit into something aggressive again. So what we do know is that although vaccines do not protect you entirely, and there is what we call immune escape, it does protect people from getting severely ill. And if you look at the people who are in hospital, it's a very small proportion in every province who are hospitalized, who are for COVID, who are vaccinated, and a much higher proportion of people who are not vaccinated. So why would you want to expose yourself to that and not go out and get vaccinated?
Certainly. And then just lastly, Dr. Chris, speak to us about whether or not South Africa is in a position to ease further restrictions and regulations such as mask wearing and sanitizing. Are we in a space to do that, and is it safe for us to do that given the fact that you just said we could expect our fifth wave in May?
Yeah, so Heidi, we already have a lot of the restrictions have been removed. So although we are still in a state of disaster, and that piece of legislation still applies, we have very few constraints on us. I know it's irritating having to wear a mask all day, every day, and especially indoors. But frankly, with only 48% vaccinated, we should really, we need to continue doing that indoors, and where it's outdoors and better ventilated, we're probably fine. But the big challenge is to get vaccination up. We were in a meeting the other day with several countries around the globe. They were telling us about their 90 and 92%, one country 70%. And those in the 90s are contemplating dropping all the measures. But those in the 70s are not. And we are sitting under 50 still. And we're still part of Africa where the vaccination coverage collectively is only 10%. So we definitely need to get out of this state of disaster. We definitely need to get society back to social life, to family entertainment, and back to work again. But if we don't do it safely and are caught off guard in May because we've let our guard down, that would be a catastrophe.
Certainly, and I think the message is so clear, and this has been the message time and time again, that if you're not vaccinated, the science and the data speaks for itself, that it provides protection, especially against severe illness and possible death. And thank you so much for your time, Dr. Nicholas Crisp. I know it's been a very rough 2 years, but we thank you and the department and all healthcare officials for the amazing work that you've done over the last 2 years and the work that you continue to do.